Hello, everybody, and welcome to the CCHI Community Conversation. This is Jorge Ungo. I'm CCHI's Language Access Advocate, and I'm thrilled to have you all joining us today. We've got a great conversation that we're going to be having on AI and interpreting. And I just want to really turn this over to our panelists, to our conversationalists, to get their conversation started. But before we turn it over to them, I do want to say a big thank you to the Translation and Interpretation Network, our sponsors for our ASL interpreter today. And with that, I'm going to turn it over to Katherine Allen to get things started. Katherine.
Hey, everyone. Thanks for having us. Really want to extend a big thank you to CCHI for re-inaugurating your community conversations and providing us to be part of it. I'm going to be a little bit, not the moderator, but maybe the guide of the conversation. So I guess I'm starting out. I'm Katherine Allen. I've been in the interpreting space for about 30 years in many different capacities, from a community interpreter to trainer, and to advocate for the profession. And I'm currently working as a training specialist for Boost Lingo. So that's just a brief introduction. Everyone can go look at our bios. I'd like to have both Winnie and Bill also introduce yourselves, please.
Okay, I'll start. I'm Winnie Hay. I am a Chinese translator and interpreter by training, and I spent 25 years in the language services industry. And for the last 8 years, I have been the career advisor for the translation, interpretation, and localization management students at the Middlebury Institute of International Studies in Monterey. It's great to be here today. Bill?
That's
Thanks,
a mouthful, Winnie.
Yeah. Thanks, Winnie, and thanks, Katherine. I'm Bill Rivers, principal of WP Rivers and Associates, and I've got an ALC slide up in part because I represent ALC on a number of language access coalitions nationally. ALC is one of the groups I work with closely. I have been Russian English, Russian interpreter and translator, an academic. I've worked in the national security sector. I've worked as an advocate and lobbyist for the last 11 years. And I'm going to talk quite a bit about how Washington, D.C. views AI and in particular, how that intersects with language access in healthcare. And, thank you again to Natalia and Jorge for organizing this, and to TIN for sponsoring, and to our interpreter for the hard work she's doing.
Yeah, exactly. So we're going to jump off a little bit, and I guess I'll start by starting to frame this discussion. We only have half an hour to talk about a very big topic, which I think has everybody's attention right now. It certainly has my attention. But let's just do a little bit of framing. And when we're talking about AI and interpreters, I think one way to look at it is to think about these new technologies that are coming in. And to be clear, we're not going to be super precise here. When we're speaking of artificial intelligence, we may reference technologies that aren't generative and don't learn from themselves, but they're all sort of a body of technology that's now hitting a tipping point in our profession and definitely having impact. So one way you can think about it is, well, first of all, what are we talking about when we're talking about artificial technology, artificial intelligence, and the technologies that are really beginning to impact interpreting? I think what we see most is, beyond the Chat GPT revolution from last fall, where you can use a sort of an intelligent chat to ask questions and have it generate everything from health information in multiple languages to training tools to glossaries. But we're talking about transcription technologies, live captioning, live subtitling, and that can come in and function in some ways either as a support or as a replacement. So often we talk about these technologies as technology that can either replace what a human interpreter is doing, or it can support what a human interpreter is doing. Sometimes the same technology can do both. Like, you may see a webinar at this point where a company might decide just to provide multilingual live captioning and cut the interpreter out completely, or you may use that captioning to help support the interpreters who are working, or as an add-on. So that this technology is coming in across the board, and this is a very important moment because we have to decide when and how and where it should be used, right? Nobody, I mean, we're not going to have some magical protector come in and say, hey, this is where it should be used, this is where it shouldn't be used. That's going to be the work of all of us. So I guess that's sort of how I would jump off and do a little bit of the framing. And I don't know what I'd love to hear, Winnie, maybe anything you would add to that, or how you see this coming in, and just to do a general framing of what we mean when we talk about AI and interpreting.
Yeah. So I think Katherine talked about technology hitting a tipping point. And I think we have seen this happen in the past in our field. For example, simultaneous interpretation that we are all taking for granted right now, it was a disruption after the Second World War. And then when I joined the industry about 30 years ago, it was the start of remote interpretation. And then when COVID hit, remote simultaneous interpretation took off, and now the latest is ChatGPT. So we've seen this kind of tipping point scenario multiple times. And I think since we're talking with a lot of the interpreters here, some of the questions that I'm getting a lot is, how is it going to impact me? And I like to think about it from two perspectives. One is, when there's a disruption, we think about, what is it going to do for me, and what is it going to do to me? So in terms of what it's going to do for me, Katherine talked about using technology as a support. As a Chinese interpreter, I can tell you, interpreting numbers between Chinese and English is very difficult. Different numbering systems takes a lot of cognitive load. So I know that there are tools now that when interpreters are interpreting, you have live captioning. I can see the numbers in front of me. That will help me a lot in terms of for my accuracy and reducing my cognitive load. That's just one example of how we can use technology to our benefit. And then, clearly there are concerns about whether, the interpreters can be sourced from other locations, and how is it going to perhaps replace some of the work that I do, right? It's still evolving. Nobody has the crystal ball. So I think as a way of approaching it, I would suggest that we think about it as an individual in terms of maximizing what is it going to do for me, and understanding the possible impact on me, and trying to minimize it. So that's kind of a overall way of how I look at the impact of technology reaching this tipping point, as Katherine said.
Right. And Bill, I want you to go, but I know you're going to do a deep dive in what we want you to go. So the one I wanted to just add, that what I didn't mention, which I needed to mention, was that in addition to these captionings, where we've really hit a tipping point is the ability for technology to go from speech to text. When you can hear the speech and go to text, but also to go speech to speech now. So some of the things that we're really seeing tipping is the ability for me, I can say something as the speaker, and you can hear an interpreted voice interpreted into another language, and it sounds like a human, and it might even sound a little bit like me. Some of the technologies are, they grab and they make it sound as much as possible like the original speaker. So it really has gone beyond just, I didn't want to leave the impression that we were only talking about like a word visual that's using. It's like, this is where the tipping point is coming, is these technologies are really getting to the point where they're replicating a lot of humanness in the communication. So I just wanted to add that. And go ahead, Bill, because Bill,
Sure.
we definitely want your expertise on where the guardrails are going to come from.
So, I think Winnie and Katherine have laid out some really very important principles we have to consider. Like, what can it do for me? What can it do to me? As Winnie said, as Katherine has pointed out, and both Winnie and Katherine have pointed out, we're already using a lot of these technologies in our day-to-day lives in different ways, in our professional lives, that would have been considered artificial intelligence, whenever they were introduced, if people had been using that term, right? There's a saying that artificial intelligence is only AI until it becomes routine, and then it's just another app. You think of Google Maps or Apple Maps, which was cutting edge, 15 years ago, and now everybody's got it on their phones. When you look at the way that the federal government has historically regulated technology, it is a piecemeal process that takes a long time, that is often done on a case-by-case, agency-by-agency basis. So even though people like Mark Zuckerberg and Bill Gates and other, leading lights of Silicon Valley, so to speak, have called for legislation to regulate AI, have called for White House action to regulate AI, even though the White House has established a task force on the appropriate use of AI. Recognizing the potential and the pitfalls, even though the Congress has committed to legislation to regulate AI, I think the realistic expectation is this will move in fits and starts, 2 steps up, 1 step back, and it will probably proceed on a case-by-case basis, sometimes actual cases in the courts, sometimes specific use cases, right? And so let's take this very specific use case of AI in language access for healthcare, which comprises not just AI interpreting, which we can break down into automated speech recognition, some kind of machine translation, and then text to speech, okay? But it also includes the potential for automated captioning, which is in fairly broad use in certain contexts. It includes a potential for AI solutions for signed languages, not just ASL, but other potential. There was a story just recently about Portuguese Sign Language in Brazil, and I think it's called Libra, Libere, the more native Brazilian sign language. And I apologize if I'm garbling that. So you say, how will this apply to healthcare, and then what's going on there? So there was a recent last summer proposed rule for Section 1557 of the Patient Protection and Affordable Care Act, also known as Obamacare, that would update the language access regulations. In that proposed rule, there was a single line that said, if a healthcare provider uses machine translation, that translation must be reviewed by a qualified human translator. So we step back and say, okay, there's these 3 major components to AI interpreting, and that core component is some kind of machine translation. Well, that might be enough. In talking with other, language and civil rights and healthcare and civil rights experts and organizations, we're concerned that it probably won't be enough, that would probably require litigation to establish. So a coalition of organizations has sent a letter to the Department of Health and Human Services saying that, you need to, HHS, which oversees language access in healthcare in the United States under Obamacare, under Section 1557, as I mentioned, the Department of Health and Human Services has to start setting up guardrails. And that brings me back to where I started, that it comes from, regulation of a technology, whether you think of automobiles, which were, introduced, popularized by the Model T, which, 100 plus years ago. Congress didn't really step in until the 60s and start mandating things like seatbelts. I hope it's not going to be that long a time period, obviously, because, for whatever reasons that took a long time, but it is still a piecemeal process. But I think healthcare may be one of the first places that where the federal government takes action. I think we're going to see courts and state bars take action around artificial intelligence in the legal field, because there have been at least 2 lawyers so far who face disbarment, losing their law licenses for turning to an AI, Chat GPT or whatever, to write a legal brief, and then getting a legal brief that was entirely fictitious. So some of the downsides of AI. And the last point is, I say that comes back again to healthcare language access, which covers spoken and signed languages. The Federal Communications Commission has published a request for comments on potentially updating its regulations regarding to language access in what they call interoperable video teleconferencing systems. We would call that Zoom, right? Where they question, with a number of citations, of academic citations, they question whether automated captioning is sufficient for all of the potential use cases of Zoom for the deaf and hard of hearing individual, right? And you think of, and some of the things they cite could be an HR meeting, right? Could be your annual review meeting. Well, that actually has to be accurate, because if it's not, there could be a cause of action, either from the company side or from the employee side. And they cite things like that. So I expect there will be some movement to start putting guardrails in while the technology evolves. Now, this is completely separate from talking about how, a company like Boost Lingo, just because Catherine's here, might be using AI for scheduling, or how Zoom uses automated captioning potentially to make a meeting like this more accessible to people. So I'll stop there.
Thank you, Bill. There's so much to dive into, so I'm hoping people are at least taking notes and then deciding to go look at these different articles and really just start reading. I mean, I think the way to make it less overwhelming, because I think it is overwhelming. The topic, I think, is quite a tsunami right now in just all areas of life. So I find, for me, I've just signed up for those newsletters on LinkedIn that are talking about AI, and I'm just trying to figure out how to talk about it and read about it and understand it and understand the scope of where it's likely to get applied right now, and where we don't need to be quite as worried as where we might be worried. So Bill, your summary for me just really kind of brings that to mind. Like, it's just a lot to kind of learn and read about and track. But Winnie, I'm curious, I don't know whether you want to talk about the Safe AI initiative on the heels of what Bill just said, because this is kind of an interpreter and stakeholder in company, it's just sort of a broad stakeholder driven initiative to also identify best practices. So I'm going to let you share that initiative.
Great. So Bill talked about the efforts to build some guidelines and guardrails in a variety of industries. And so probably in the April and the May timeframe, a number of the stakeholders in the language industry started talking, like, me talking with Catherine talking with Bill, right? So very organically in May, 11 of us, we call ourselves the Sparks, got together and said we need to create a platform for the interpretation industry to have a voice in all this development. So we created a group. It's the stakeholders advocating for fair and ethical AI in interpretation, an abbreviation interpreting Safe AI. We created a webinar similar to this one at the end of June, and after the webinar, we launched a survey to solicit feedback from the broad industry stakeholders about how we move forward, how we create the organizational structure. We received close to 600 respondents from over 20 countries expressing support, and over 200 of them raised their hand to say, I will volunteer to contribute to this effort. It's beyond our expectation. And so where we are right now is we are in the process of notifying all the volunteers to start the work. And by the end of October, we would want to launch a perception survey, essentially taking a snapshot, a point in time snapshot about the perceptions and the attitudes toward the use of AI at this point. And we want to publish that survey by the end of the year. And from that point on, there's still a lot of work to do to get us to a point of creating some guidelines. Because right now, really, there are more questions than answers.
Right.
And it takes all of us collectively to put our heads together and make the efforts to put the guidelines together to ensure equal language access for the LEPs. So that's a brief update.
And thanks for sharing that. I put the link in the chat for everybody to the website that's up and running. And, we're really hoping that this entity will launch and and thrive and survive and move forward, because we've never done that successfully as a profession. We have never had sort of a just industry and professional field-wide organization to say, here are global best practices for remote interpreting and on-site interpreting, for example. We spent a long time talking about when and how we should use remote interpreting versus on-site, and yet we never kind of had a more comprehensive response. And I think we all really are trying to learn the lesson from not having done that, and try and do that more now. And I'd like to I know we have a few minutes left. I wanted to go beyond the scope of language access around immigrant-based interpreting, in healthcare, and just talk a little bit about how I think anyway, that I think that, as Bill said, the way this impacts the field is really going to depend on where you're working in the field. And ironically, probably the biggest disruption coming in right now is in conference interpreting and in remote simultaneous interpreting. And so I think it's really important for everyone to start thinking about, what does good enough mean? Because that is where we've gotten to the place where many of these technologies are good enough in many settings to, achieve a very comprehensive communication. And so if you take the conference interpreting setting and you have the ability for where there's more kind of scripted and predictable language around how people give speeches, and their written language, and in an automated speech recognition tool can actually grab that and get really good accuracy. If not some odd syntax, and maybe they missed the metaphors, and maybe not everything was interpreted correctly, but the broad overall message is there, and there's pretty low risk to the 5% that's not there, right? And that the higher risk, ironically, is in this area. I'm not saying there's not a lot of risk and there's not a million use cases in conference interpreting where you don't want it. I'm just saying that there are not legislative guardrails outside of the agreements in Europe and in diplomatic interpreting on conference interpreting. And so there's just actually free room for innovation and companies and capitalism to go in and sell products that fully replace interpreters. And I think there's less incentive in that area right now for big investment to support interpreters. So I think that's an area that's really open to disruption. And I just really encourage people to, let's start working on those best case scenarios and guardrails for, so that we can expand access, expand communication, but not at the expense of where the human needs to be there, right? So I just wanted to talk about that a little bit so we balance it out, because it really is going to play out differently depending on where you are, and if there's language access legislation or if there's not. And I think that's something for people to be aware of and to really pay attention to your own arena. So Bill.
Yeah, I was just, and I saw a question just come by in the chat from Suzanne Pranger, like what guardrails could be in place. And it could be anything from HHS saying, in the regulation on healthcare interpreting that you can't use AI interpreting in healthcare. I'm not sure they would go for that, out to things that would be analogous to what they proposed with respect to machine translation, where there has to be some human review. And it's interesting, Catherine, because I had this conversation, I had a conversation with colleagues in Dubai earlier this morning about, this imbalance between the very high status that conference interpreting has in our profession, and the very high stakes and, sometimes relatively low status that medical community and other types of social services interpreting have, where the consequences can be immediate and devastating for an individual, right? And I think part of what this Safe AI group is doing, in my view, is laying out, okay, here are some use cases, and healthcare interpreting. If someone has the wrong limb operated on, or the wrong kidney removed because of a tumor, because of a mistake that can be attributed to a mistake in interpreting or translation of a medical record, for example, who's liable, right? And is that Silicon Valley startup going to promise Monterey Peninsula Hospital that it'll be liable if it screws up, right? I mean, that's one of those very practical questions that kind of don't cross the minds of the Valley Bros, where they say, "Oh, you signed the terms and conditions." When you get a new app and it's got 50 pages of very tiny text, and you just scroll through, or just click accept. You signed away all your rights. That doesn't hold up in a medical context. That doesn't hold up when children and elderly people are injured, right? So what does that look like? Now you can see I may be coming at this with some bias towards the human in the loop, or the human in control, and I freely admit that. But I think there are very strong reasons to say we need guardrails, and we need to start working through those guardrails right now.
Winnie, I'm kind of curious to hear. I think you're so articulate at talking to the individual interpreter, and I know we have a lot of individual interpreters on this call in addition to all the other roles many of us play. But I just think it is a time of disruption, and we've been through many times of disruption, and you're right in the middle of guiding students and many other people. And so I just would love to hear your thoughts about sort of proactive, positive, manageable ways to be in the middle of this moment.
Yeah, so we have 5 minutes left, so I'll be brief. I think to build on what I said earlier, this is really the time to step back and explore, because the environment is changing so rapidly. And furthermore, just like what you're doing today, joining this webinar, this is part of your exploration and network. Stay connected with your associations, with your colleagues, because really nobody has the answer. We're all trying to figure this out. And so if you're connected with the network, you'll get the information sooner rather than later. So that would be my recommendation.
And how about you, Bill? What are your final thoughts?
I've seen a lot of questions go by about, does AI make more or less errors, or comparable errors? Is anybody studying this on the ground? The problem is that right now it's so new that we're not getting the kind of rigorous, peer-reviewed academic studies. I'm sure that companies are producing, the AI purveyors of AI, the startups will be producing their own studies. So it's just so new. I will say that, yes, humans do make errors, and somebody pointed out, maybe it's easier for a human to confuse left and right. Although I find that I'm putting myself back in the days of when I was doing interpreting, and, I confuse left and right on a day-to-day basis. You tell me to turn left, I'm liable to turn right, but that's just my cognition. But it's my contention that humans tend to make more consistent errors, that if we know we perform at a certain level, we know what kinds of errors we're subject to, we know what fatigue does to us, but we also have a real-time feedback loop where we can go back and correct. AI spits it out, it's gone, and there is no feedback loop, there is no self-monitoring there, and that's a crucial difference for a human interpreter. Having been a conference interpreter, I can say many times I would turn to my partner, say, "Catch that? Can you help me out here? Put the sandwich down," because they're taking a break, right?
Yeah.
And AI doesn't have a partner. It doesn't have a feedback loop. It doesn't have a mechanism to catch errors, as far as I know. And so that's another area of concern.
Yeah, and I get it is. These are all areas of concern. I guess for me in broad, I love all these questions that are going through, and these are all the right questions. And the what's important is that we actually try and encourage our workplaces, our associations, our colleagues to put the time and money and resources to identify this and make sure that we have some control on how AI is applied, as opposed to just having it be applied. I think that's what I'm hoping, is that we don't miss this moment, and that's part of what the task force is about. And then I would just, say that, remind all of us that we're all 30 years into nonstop change and transition, and that's not going to change, but we already are rolling with it. So let's use all those skills and not lose all the precious professionalization that we've worked so hard to get, but bring that forward in with this new technology. That's really what I'm hoping for. So I guess we're down to 1 minute. So I'm assuming Natalia or Jorge, if you're going to come in and wrap it up for us. But it's been an honor to be part of this conversation, and I hope it sparked good ideas for people.
It's been amazing, Catherine. Thank you all so much. Thank you, Winnie. Thank you, Bill. And of course, thank you to our ASL interpreter, Adrian. A riveting conversation. I feel like if we were having this conversation sometime next year, it would be a completely different conversation. So maybe we can have you all back again for another community conversation. Want to thank all the attendees for joining us today. We've got over close to 200 attendees participating. So thank you, everybody, for your participation. And please stay tuned to the work of Safe AI. And participate. Just like Winnie said, you know, we all need to be involved, and I have a feeling there's going to be a lot of opportunity to get involved with the Safe AI folks. So with that, thank you all so much for joining us, and have a wonderful rest of your day.
Thank you.
Thank you,
Bye-bye.
Thank you, everyone.
everybody.
Bye-bye.